What is tennis elbow and why you might have it? The medical term is lateral epicondylitis, and it happens when the tendons on the outer part of your elbow become inflamed from overuse. Tennis elbow usually starts as a mild ache on the outside of your elbow, especially after activity. And here's the kicker: if you keep pushing through the pain, it can become chronic, which is much harder to treat. Today, we're digging into a condition that affects way more people than you'd think: tennis elbow. And no, you don't need to play tennis to get it. If you've ever felt a dull ache in your elbow after a day of typing, lifting, or even gardening, this episode is for you. What is tennis elbow and why you might have it? Let's start with what tennis elbow actually is. The medical term is lateral epicondylitis, and it happens when the tendons on the outer part of your elbow become inflamed from overuse. These are your extensor tendons. It's one of the most common causes of elbow pain, especially in people who use their arms a lot for work or hobbies. That includes hairstylists, construction workers, office workers, and yes, racket sport athletes too. So what causes it? The short answer is repetitive strain from lifting, gripping, typing, or using tools. Poor technique, weak forearm or shoulder muscles, and even just doing the same motion over and over can all increase your risk. Tennis elbow usually starts as a mild ache on the outside of your elbow, especially after activity. But over time, the pain can worsen. You might notice burning or sharp pain in the outer forearm, stiffness, especially in the morning or after use, a weaker grip, like struggling to twist a doorknob or hold a coffee cup, pain when extending your wrist or lifting something, even light. And here's the kicker: if you keep pushing through the pain, it can become chronic, which is much harder to treat. So when should you actually see a specialist? Here's some red flags: pain that lasts more than 6 weeks, difficulty using your hand or arm for daily tasks, or pain that's not improving with rest, ice, or over-the-counter meds. Swelling, redness, or a noticeable bump is also a concern. Worsening pain or pain that lingers even when you're not using your arm. If any of that sounds familiar, don't ignore it. Early care can really make all the difference. So what can you do at home? Well, we want to start with the RICE protocol: rest, ice, compression, and elevation. Ice your elbow for 15 to 20 minutes a few times a day. Use a light compression wrap if needed, and avoid those activities that make the pain worse, even if it means modifying your routine a bit. Anti-inflammatories like ibuprofen or naproxen can also help reduce pain and swelling. And many people find relief using a forearm brace or wrist splint to reduce the tendon straining during activity. Physical therapy is often the next step. A therapist can guide you through stretching and strengthening exercises that support healing and restore mobility. Some great at-home exercises include wrist extension stretch, which is great for relieving tension before gardening or computer work, forearm rotation drills to build stability without strain, stress ball squeezes to gradually rebuild grip strength. Consistency is key. These exercises are not complicated, but you have to do them regularly to see results. When conservative care isn't enough, so that rest, bracing therapy doesn't work, that's when advanced treatments come in. Non-surgical options like platelet-rich plasma therapy, ultrasound-guided procedures, or even shockwave therapy. These are designed to stimulate healing in the tendon without needing full surgery. Cortisone shots can also be effective, but they're usually short-term and they're not typically used for a long-term fix. Repeated use of cortisone can also weaken your tendon. And if all else fails, surgery is sometimes an option when persistent symptoms have not improved after many, many months. It often takes several weeks to several months, depending on how severe and how consistently you follow your plan to feel some improvement. Prevention is just as important as treatment, which means warming up before activity, doing those stretching and strengthening exercises, using proper technique and ergonomic tools, and taking breaks from repetitive tasks. Strengthening your shoulders, forearms, and wrists is going to help, and being mindful of technique, whether you're lifting boxes or swinging a racket. Also, don't underestimate lifestyle factors like a healthy weight, managing stress, and avoid smoking. These things can all slow down healing. Tennis elbow can be so frustrating, but with the right care, it's very treatable. Don't wait for the pain to become chronic. Listen to your body, take action early, and give your elbow the chance to heal. I personally have experienced tennis elbow through various parts of my life. I'm a surgeon, so I'm often doing rotational movements with my hand during surgery. And there are definitely weeks where my forearms just ache. And it not only happens in the outer part of your elbow, but it starts to go down your forearm, follows the path of your extensor tendons till sometimes even inside your thumb. And so for me, I have to remember always to do those stretching and strengthening exercises. This is not something you can just do for a little while and forget about and never do again. Usually, if you're susceptible to tennis elbow, that means that you are going to have to continue doing those stretches and strengthens through the entirety of your life. I think this is really hard for some people as they age to understand that if you have quote unquote a bum joint or a muscle or tendon that just doesn't function the way it used to when you were younger, it is going to have to be something that you work on for years and maybe for the entirety of your life. I think platelet-rich plasma is an awesome option. Platelet-rich plasma is natural and it's an anti-inflammatory and sometimes boosts that healing that has stalled, which tends to happen with tennis elbow. And there's actually really good studies on PRP with tennis elbow, so I encourage you to look into that as well. Thank you for tuning in to The Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.